Welcome to Integrity Linguistics Institute. What is OET Reading Part A? OET Reading Part A is called as expeditious reading. We'll be covering about time management strategies. We'll be discussing why match the following questions needs to be done. We'll be talking why we need to prioritize the questions. We will be talking how important trusting your intuitions and instincts are. That is that sixth sense, as I told you. And we'll be also discussing about the importance of grammatical accuracy, especially in the fill in the blank questions, and how to avoid overthinking and how to be very precise when it comes to reading part A, short answer type questions, synonym recognition, okay, because you're performing under pressure, time pressure, and you need to have extensive vocabulary range, and you should be able to spot synonyms and paraphrase information, instincts, and these are the benefits of attending today's session. Okay, a very solid strategy, confidence, and certain tools to stay calm, focused, and effective under pressure. All right. So that is the class agenda. So now let's take the reading part A question paper. Now, as you can see over here, this is OET reading part A. Okay, so those who are relatively new to the OET preparation, you will be getting one main topic over here. So the main topic over here is the use of feeding tubes in pediatrics. Okay, so pediatrics are, children's, infants, babies. And when it comes to feeding them, we use feeding tubes. So the entire text part A is related to the use, okay, the usage of feeding tubes in pediatric population. And that information has been divided into four texts. Okay, so we have text A, text B, text C, as well as text D. All right. And each of the text will have one particular set of messages. Okay, I'll be discussing that later on. And associated with that, there will be 20 questions. The first few questions will always be match the following questions. Then comes short answer type questions, and then comes fill in the blank questions. All right. So now let's be a strategist. Okay, it's because as I always tell, when it comes to OET, you have to be a strategist. Okay, so who's a strategist? A strategist is a person who has the knowledge of what to do and how to do certain things. Okay, simply knowing, okay, this is OET reading part A. Okay, there will be 20 questions. That basic knowledge is not going to be enough. You should know, okay, if I get a question paper, if I'm sitting in the examination hall, I have to take all these factors into account. And this is the way I need to navigate through the entire 15 minutes. Okay, so let's see what are the things that a strategist will do when they get the OET reading question paper. So everyone over here, just imagine. Okay, so I want everyone to imagine over here. And what are you imagining? You're sitting in the real examination hall. Okay, all of you over here are in the real OET examination hall. You have finished OET listening part A, part B, part C. Okay, and now they have given you OET reading. So remember, you don't have 100% brain capacity. You're already tired. Okay, you're already tired because a lot of mental stamina has been used for OET listening. And also maybe the listening did not go very well. Maybe you are a person with high standards and maybe you didn't perform very well. So you're feeling a little bit anxious. So you're in an exam situation. You're very anxious. Okay, you're a little bit tired. And in that state, the OET people, they have given you this question paper. Okay, and now they're telling you, you have 15 minutes time. Okay, now what will be the first thing you do? Okay, so again, as a strategist, the first thing you do is forget whatever happened in OET listening. It does not matter whether it went very good. It does not matter whether it went very bad. Okay, thinking about it, dwelling on it is not going to help you in reading part A. Okay, so just, erase the slate clean and bring your complete attention and awareness to the OET reading part A question paper. Your entire focus should be here. And when they tell you your 15 minutes time starts now, the first thing you do is read the main topic over here. So what's the main topic? The use of feeding tubes in pediatrics. Okay, pediatric population, feeding tubes, the use of feeding tubes. That is the main topic over here. Okay, just read it one time, but you understand quality reading is more important. Now, before going to the questions, okay, so before you go to the questions, you stay in the passages over here. Now you see, when it comes to text A, okay, and this is a very tough reading part of question paper. Now, when it comes to text A, there are certain headings over here. Okay, this is first subheading. Okay, and this is the second subheading. Right. So what you do is with your pencil, okay, you track as you're reading. So here you need to read. Okay, text A is about pediatric nasogastric tube use. Okay, so tube use of nasogastric tube use in pediatrics. That is the heading subheading over here. Now, what is the second subheading? Now, this information you completely avoid. Okay, this is not a heading. Okay, this is not a heading. This is the content of the text A. So content we will be. You should always read with a focus. Okay, you should have an aim. You should have an objective. Okay, only with an aim, only with an objective, you should read the content. Simply for wasting time and simply without any aim, without any focus, you should never read the content. So content we will read later, but you focus on the headings over here. Pediatric nasogastric tube use. And as soon as you have read this, you come to the second subheading over here. Now, what's the second subheading? Issues associated with pediatric nasogastric tube feeding include. Okay, so now it is not an pediatric nasogastric tube is not completely risk free. There are certain issues. Okay, issues means what? There are certain problems. Okay, so that here, so this content over here, whatever content over here, what are they? They are all problems. They're all problems, or they're all risks associated with pediatric nasogastric tube feeding. Now, you understand, right? So you did not read this and you did not read this. Okay, but you have a small idea. Okay, this is going to be an introduction, and these are the problems associated with pediatric nasogastric tube. So see, how many seconds do you need to read these two small headings? Maximum 5 seconds. Let's say 6 seconds. Okay, 3 seconds for this, 3 seconds for this. So within 5 to 6 seconds, you should be able to finish text A, and you should be now coming to text B. Just 6 seconds you have read, and within 6 seconds you understand, okay, text A is about an introduction to pediatric nasogastric tube and also about the problems associated with that thing. Now you come to text B. The 7th second, usually you are in text B. Right. So if a student is reading the entire text over here, they'll be spending 20, 25 minutes, 25 seconds over there. Only from the 30th second, you're coming over here. But here in the 6th or 7th second itself, you're coming to text B. And this is very, very important because every single second is precious. Okay, because time management, that is the most critical thing you should understand. Now let's talk about text B. And here also we have certain headings over here, right? So what's the first subheading over here? Inserting the nasogastric tube. Okay, so these are not the problems associated with nasogastric tube. These are not the issues. These are how to insert. Okay, so we have a pediatric patient and how are we supposed to insert the nasogastric tube? And here also we have subheadings. So we have wide bore. Okay, and we have fine bore. Okay, so maybe these are the two different types of nasogastric tubes. And then we have one heading over here as well. Okay, wash and dry hands thoroughly. Okay, so here they're talking about the process. So when we are inserting the tube in a pediatric patient, we need to wash our hands, we need to dry our hands, place all the equipment needed on a clean tray, and then we have all these steps over here. So again, there is no need for you to read the content. As I told you, content should never be read without an aim. Content should never be read without a focus. Always with a aim, with a focus only, we need to read the content. So there is no need for you to read that. Okay. Now you see over here, maybe within 5 to 6 seconds, you have a small idea of what is text B. So what is text B? The insertion of the nasogastric tube, wide bore, fine bore, and also the steps, wash. And so hygiene is very important, and how hygienically we have to insert all these things. Okay, so that is text B. Now you see, from maybe the 12th second or the 13th second, you are now in text C. Right. So this is how you should go. If you're simply reading text A and text B, you will forget everything you have read. Okay, I'll come back later. Now let's come to text C over here. Now what is text C, Rubina? What are you doing, Rubina? All right. Okay, so now let's come to text C. Okay, so text C we have a flow chart. Okay, so this is what we call as a flow chart, right? So I'll just type it over here. So this is something that we have learned when we were college students or school students. Okay, so we have a flow chart over here, and this also. So you can expect flow charts, you can expect diagrams, you can expect tables, you can expect graphs in OET reading. Everything will look very complex. Okay, some information will be complex, but okay. Now here we have a flow chart. Now here also we have some headings. Okay, so here we have, okay, so what is flow chart? Flow chart is basically a step-by-step process. Okay, so this is step number one. Okay, so step number one is estimate the NEX measurement. Okay, and then some things we have to do. And then over here, so after we, so I'll just type over here. Flow chart basically means this is step one. And now this is step two. Okay, now checking. Now what the student, now what the medical staff must do, they must check. Okay, they must check whether the aspirate was obtained or not. Okay, that is step two. And if the aspirate is obtained, okay, if the, so again, I'm not reading in detail over here. I'm just, those who are new to OET, I'm just giving. So if an aspirate is obtained, then we have to do these steps. If an aspirate is not obtained, then we have to do these steps. Okay, and then we have to once again, then this is step three. Okay, so this is a, step-by-step process. Okay, so this is something that you must be familiar as medical professionals. Okay, we have a flow chart. Again, let's take a look into the headings over here. Okay, so the main heading over here is aspirate obtained. Okay, so the whether aspirate is obtained or not. And then over here we see one heading, try each of these techniques to help gain aspirate. So this information over here is the different techniques that is used to help obtain aspirate. And here, whether aspirate is obtained or not, question mark. Proceed to feed or use tube. So here the heading is, now you have to proceed to use the tube or, feed the patient. And here we have, do not feed or use the tube. Okay, and then we have something related to pH. Okay, now you see over here, only the headings. Only the headings. Now, how much seconds will you be able to spend over here? Maximum 8 or 9 seconds, right? So within 8 or 9 seconds, you are reading and you're also understanding. Right. So that is the most important thing. You're not simply reading. You see, every person can simply read. Even an LKG student can simply read. Okay. But simply reading is not what we want. If you're spending 1 second, that 1 second should help you. Right. It should help you in the future. So that is why quality reading is important. So minimize the content you're reading, the most important things you read. And as you're reading, don't simply read it. Try to understand the information and go. Right. Now let's come to text D. Okay. Now let's see what is, so text C is all about flow chart. Step one, step two, step three, something about aspirate, something about usage of feeding tubes, some things about pH and all was mentioned. So that is there in your memory. Now you come to text D. Now text D over here, we have two headings, administering feeds or fluid via a feeding tube. Okay. So these are the types of food we are giving. So feeds means solid foods or fluid. Okay, so now we are administering the patient with foods or fluids using a feeding tube. So all that information will be given over here. And then we have another heading, that is this one, under no circumstances. So here they're giving you a warning. Okay, under no circumstances should the feed be decanted from the container in which it is set up from the special feeds unit. Okay, so there's giving you a warning that you're not supposed to do. That is, should be decantation. Decantation basically means, okay, that's a very complex vocabulary. I'll be discussing that later on. From the container in which it is set up from the special feeds unit. Okay, that is something related to container. Okay, so we have a container and we should use it very carefully. Okay, so that is a warning that we have given over here, and that is the content over here. Now you see, how many seconds do you think you need to just read these headings? Okay, so on average, you give 6 seconds. Okay, so 6 multiplied by 4 is 6 4s are 24. Okay, give it plus another 6 seconds you give, 30 seconds. Now you see, you are doing the reading part A in a tired state. Remember, when you're at home, when you can simply read all the 4 texts and you can remember everything. But on the examination day, you're in a stressful environment, you're a little bit tired. So even if you try to read text A, B, C, and D continuously, you are not going to remember everything. So don't waste your energy, and worse, don't waste your time. Instead, when they tell you your 15 minutes time starts now, with a very cool, calm mind, you just read the headings over here. Now, you see, within 30 seconds, within the first 30 seconds, you have a clear idea of what to expect. So, text A is about introduction to nasogastric tubes and problems. Text B is about insertion. Okay, and how to hygienically insert the tubes. That is text B, and text C is about a flow chart. Okay, the flowchart has something about aspirate usage as well as a pH. And then text D is about administering of foods. Okay, how to administer fluids, how to administer feeds, and also a warning. Now see, within 30 seconds, within first 30 seconds, you have a clear-cut idea of what you can expect in text A, B, C, and D. And from the 31st second or even earlier than that, you can start finding the answer to the first question. Whereas other students, they will simply read A, B, C, and D, and they will waste 2 minutes, maybe 2.5 minutes, maybe even 3 minutes they will waste. Okay. And they will not remember anything. Okay. Nothing will be registered into their mind. And then after 3 minutes only, they are starting to do the first question. Here, after 30 seconds, you are coming to the first question. So there is a big difference between 30 seconds and 3 minutes. So this is why I told you, you have to be a strategist. Right. So if you have the right strategies with you, the more better it is going to be. Right. Now, the other thing over here is that, so we have different types of questions. Right. So that is, we have match the following questions that you can see over here. The first few questions will always be match the following questions. The next few questions will be short answer type questions. And the next few questions will be fill in the blank questions. Okay, so you have spent 30 seconds. You have a clear idea of text A, B, C, and D. Now you have two options. First option is to do the match the following questions first. Okay, so match the following questions are general. Okay, general. That means they are not specific. And since they are not specific, they are not time consuming. Okay, that is match the following questions, right? So match the following questions over here. You need to understand that these are general questions because they're asking you read the sentence and find out where this sentence is located. Is it located in text A, text B, text C, or text D? Okay, so it is not a specific, they're not asking you a specific answer. They're asking you generally, okay, where do you think this information is located? And therefore, these questions are not time consuming. Whereas if you come to these questions, if you come to short answer type questions, that is not the case. Short answer type questions as well as fill in the blank questions, they are not general questions. Okay, they are not general, they are specific. Okay, there is a specific answer. Okay, so they are asking what type of tube should you use? So that's a very specific answer, and therefore you need to hunt. You need to hunt and you need to locate where the answer is hidden, right? And that takes time. So therefore, these questions are time-consuming questions. Okay, so you need to understand short answer type questions as well as fill in the blank questions. They are not general questions, they are specific questions, and therefore they are time consuming. Okay, so you have two options. Should you do the questions that are time consuming, or should you do the questions that are not time consuming? Okay, so my advice is you should always do the match the following questions first. Because why? These questions are not time consuming. See, within 30 seconds, you have read text A, B, C, and D. And here, within the next 1 minute or next 2 minutes, if you play your cards correctly, if you're thinking very clearly, if you're trusting your intuition, within 1.5 minutes or within 2 minutes, you can basically find answers to all these 7 questions. Right? Because why? These are not time consuming questions. Okay, so I'll just type thing over here. So the 30 seconds you have spent for reading A, B, C, and D. Right? And next, okay, so let's give, I'm going to be very generous over here. I'm giving you 2.5 minutes. If you do extremely well, 2.5 minutes you don't need. Okay, you don't need 2.5 minutes. Within 1.5 minutes or less than 1.5 minutes itself, you can find answers to all these 7 questions because they are not time consuming. But I'm giving you little bit generosity over here. Within 2.5 minutes, you will get 7 correct answers, right? So now, how is your mindset going to be? That is, you have received the question paper. The first 3 minutes, you have 7 correct answers. How are you going to feel? Tell me, how are you going to feel? That is, within first 2, 3, 4 minutes itself, you have found, first 7 correct answers. Whereas the student who is sitting next to you, they are only starting the first question. That is, they spend 2.5, 3 minutes reading text A, reading text B, text C, and text D. Okay. And now they're starting to do the very first question. You are over here and you are now going to the eighth question. So don't you think that is going to give you a psychological advantage? It definitely is going to give you. It is going to boost your confidence levels. You're going to feel very good about yourself and your thought clarity will improve. Okay. And the time consuming questions. Okay. And with that mindset, if you're going to the difficult time consuming questions, it becomes much more easier. Right. And you know what the second advantage is? The second advantage is you will establish something called as familiarity. Right. So see, when you're doing the first 7 questions, okay, when you're doing the match the following questions, you're reading the question and you're going to the text A, you're going to text A, text B, and you will be reading with an aim. Okay, you're reading with an aim, you're reading with a focus. So you will be reading, okay, some part of content. You will be reading some content from reading part A, you will be reading some content of reading part B. Okay, you'll be reading some content of reading part C and you'll be reading some content of reading part B, D. So by the time you finish first 7 questions, you already have read A, B, C, and D thoroughly. Okay. The other students, what they were doing, they were not reading thoroughly. They were simply reading. Okay. But here you were reading with an aim. You were reading with a focus. So therefore your brain was much more attentive. So by the time you finish these 7 questions, you have established familiarity. You are very, 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 very familiar with the contents of A, B, C, and D. And this familiarity will definitely help you when you're doing the time consuming questions. Because as soon as you read the question, your mind will tell you, yes, this is in text C, second paragraph, third line, fourth word. That clarity you will be getting. Whereas if a student is directly coming to the eighth question, skipping the multiple choice questions, and if they're directly coming to the eighth question, they have no familiarity. Okay, so now they have those students, what they need to do, they need to read the eighth question and now they have to, search where the information is because they don't have any familiarity. So they will be wasting time. But you will not be wasting time. Okay, so this is why these strategies are extremely effective. Okay, so it is not about your English language proficiency. Everything is related to your time management skills. And this is how a smart student will approach the reading part A question paper. And then they'll be coming to the eighth question, ninth question, and then the fill in the blank questions. All right. And now, before we actually do the reading part A practice, just one more thing I want to tell you. We have 20 questions over here. Do not expect all the 20 questions to be of the same difficulty level. Never ever expect all 20 questions to be of the same difficulty level. There will be easy questions, there will be medium difficulty questions, and then there will be advanced difficulty questions. Right. And when it comes to reading part A, you need to understand it is all about time consumption. Right. That is, the difficulty level of a question is basically related to their time consumption. So what do you understand from this? That means if it is an easy question, okay, if the level of difficulty is very, very easy, then it will not consume too much time. Within 5 seconds, you will be able to find the answer because it is a easy question. The level of difficulty is very, very easy. So it will not consume too much time. But if it is a advanced level question, the language is very tough. Synonyms are there, paraphrases are there, a lot of indirect messages coming. Okay, and it is very difficult for you to pinpoint the correct answer. So that means it's a very difficult question. Now, what is a difficult question? Difficult question are basically questions that are extremely time consuming. Right. So if I give you the most toughest reading part a question paper, but if I'm giving you 5 hours time, obviously every one of you will get 20 out of 20, right? But if I'm giving you the toughest question paper, but if I'm giving only 15 questions, 15 minutes, obviously you will be struggling because why? You haven't perfected the time management skill. Right. So what should you do? So when you are doing the questions over here, sometimes you can expect difficult questions to come anywhere. So maybe the fourth question over here. Okay. Maybe the fourth question over here will be a very difficult question, right? And then maybe the 11th question over here. Okay, maybe the 11th question as well as the ninth question will be very difficult questions. Again, it will change the order like this. Now, what should you do? So when you are doing a question and you will be able to sense, what, this ninth question is extremely tough. Okay, I'm not able to find the answer very easily. It is taking a lot of my time. Okay, and I don't think I will be able to find the answer soon. So if your mind is telling you, okay, if your mind is telling you, if your intuition is telling you, this is a tough question, this is a time consuming question, and I have already spent 30 seconds, I have already spent 40 seconds, and still I'm not able to find the answer, then what you need to do is you need to temporarily skip it. Just skip it temporarily and then go to the next question. Okay, this skill is very, very important because you should always prioritize the easy questions. Okay, and then once you have finished all the easy questions, then towards the end, you will be coming once again to the, once again to the, you'll be coming to the tough questions that you have temporarily skipped. You are going to be very happy. You will be thinking, you know what? I have 17 correct answers. Okay. And I have 3 minutes left. And in the next 3 minutes, I have only three difficult questions. And here you can spend 1 minute per difficult question and you will be able to find the answer. So the strategy is if you come across a difficult question, skip it temporarily, prioritize the easy questions, and towards the end, you'll focus on the difficult questions. Okay. You will be able to get the answer much more easily. Right. That is extremely important. That is, you should never be very stubborn. Oh, unless and until I find the answer to the ninth question, I will not go to the 10th question. Do not think like that. Okay. You will be spending 1 minute, maybe even 2 minutes. You will be spending on the ninth question. What happens if the answer is wrong? Okay. So you spend 2 minutes on the ninth question. If the answer is gone, if the answer is wrong, okay, you are lost 1 mark over there. But the most important thing you need to understand is that you have lost 2 minutes, and those 2 minutes you could have utilized for all these questions, right? So that is why you should always prioritize the easy questions first. Okay, this is how you should be a strategist, right? So now, everyone, once again, remember that you're in the examination hall. They have given you the question paper and you have read the main topic, the use of feeding tubes in pediatrics. Text A, pediatric nasogastric tube use. Issues associated with pediatric nasogastric tube includes. Text B, inserting the NG tube, wide bore, fine bore, hygiene. Okay, wash and dry hands thoroughly, hygienically do the insertion process, place all the equipments in a clean tray and all that. So we have this information. And then we have text C, which is a flow chart. Something about aspirate is mentioned. Something about try each of these techniques to help gain aspirate. Proceed to feed or use tube. Do not feed or use tube. Something related to pH is mentioned over here. And then we have text D, administering foods and fluids via feeding tube, and a warning: under no circumstance should the feed be decanted from the container in which it is sent up. Okay, so those who don't know the meaning of decantation, okay, so how do I explain it? Okay, so I'll just draw it very over here. So I won't be taking too much time. Okay, so just imagine this is a container. Okay, so this is a container A and this is a container B. Okay, so I'm not going to use, okay, so let's imagine there are some medications over here. Okay, so there is some medicine over here. Okay, so this is the medicine, and this is all water. Okay, okay, 1 second. So because those who don't know the meaning of decantation, okay. See, for example, you have put some water into the container and there is some medicine there and you have mixed it. Okay. So, but if you keep it aside, okay. So after 1 or 2 hours, what will happen? The medicine will be here. Okay. Because medicine is heavier, the medicine will fall down and here only the water will be there. Okay. Only so the upper layer will be the water. The down layer will be the medicine. So some people, so what is decantation? Decantation basically means pouring the upper layer. Okay. So here, decantation basically means, so just imagine this is, okay. So this is the, okay. So this is the medicine part. Okay. And only the water. Okay. So only the water is going here. Okay, so this is what we call as a decantation. That is, you're trying to separate, the residue. Okay, so this is the residue. Okay, so this process, okay, this process where you're trying to separate the residue from the upper layer of that water element, this process is what we call as decantation. Okay, so at least this is what I studied in biology. So from my memory, I'm saying, so I could be wrong, but from my understanding, that is what the meaning of decantation is. So here they're telling under no circumstance, that is under no situation, should the feed be decanted. So as you can see, the feed will be in the topmost layer or the water will be down, whatever it is. So we should not separate the feed. Okay, we should not separate the feed from one container to another container. Okay, so that is something that we should not do. That is the meaning of, that is the warning over here. All right. All right. So now we have text A, B, C, and D. Okay. So you have understanding. Okay. So let's just go very quickly. Issues, introduction, insertion, wide bore, fine bore, hygiene. Text C is about aspirate, proceed to use tubes, pH, administering foods or fluid via feeding tube, and a warning that we should not decant all these things. Now let's come to text A over here. I mean, part A, first type of questions. So what is the first question over here? The first question over here is the risks of feeding a child via a nasogastric tube. So here what I'm trying to help build in you is your intuition. Okay, so remember when I told you that you're a medical professional, okay, and you have to have faith in yourself. Okay, you should not doubt yourself. Don't doubt yourself. Okay, don't, underestimate yourself. Okay, believe that you are here for a reason. Believe that it is completely possible, and you have to trust your medical knowledge. Okay, so you have to trust your intuition over here. Okay, more than your language proficiency. Okay, so what is your instincts going to tell you? So your sixth sense. Okay, so this is what I'm telling by your sixth sense over here. Right. So let's do the reading of the very first question. Let's do the keyword analysis. So here the question is the risks of feeding a child via a nasogastric tube. So what is the key word over here? The key word over here is the risk. Okay, so when we are feeding a child via a nasogastric tube, there are going to be certain risks over there. Okay, and your duty is to find in which text this information is located. Is it A, B, C, or is it in D? Now, what is your intuition telling you? What is the keyword over here? The risk. Is it going to be in text D? Because text D is what? Administering fluids. Okay, and here there is a warning about decantation. So your intuition is telling no, it is not going to be there. What about this? Aspirate, all these things, pH and all. No, here they are not talking about a risk. Here they're talking about step 1, step 2, step 3. So here also your intuition is telling no, it is not going to be here. And what is here? Insertion of the nasogastric tube. So here they're telling thus hygienically how we should insert. Here the question is asking you what are the risks associated. So your intuition is telling no. But text A, what is text A? There is an introduction. And here they have written issues. Issues means problems. Problems are always risky. Problems associated with pediatric nasogastric feeding tube. Right? So your intuition must kick in, and your intuition must be able to tell you, yes, very good, Lakshmi. That is, the answer is going to be in OET reading part A, text A. Right. So you have to trust your instincts. Maybe it will go wrong. Maybe your institution will tell you it's in text B. No problem. Okay. No problem. You have to, if it is your intuition telling it is text B, then you just see. If it is not going to be there, then you go to the next thing. So here your intuition is telling it is going to be in text A. And see, did we read the content? Did we read full text A? No. We have only read the headings. But still, you're able to say with clarity, it is going to be in text A. So you will be directly coming to this heading, issues associated with it, and just read. The procedure for inserting the tube is traumatic. Okay, so this is a risk over here. It is going to cause trauma in majority of the patients. The tube is very noticeable. Okay, patients are likely to pull out the tube during reinsertion. Aspiration might happen if it is incorrectly placed. So if it's an inexperienced staff is placing, it may cause aspiration. Okay, there is an increased risk. See, increased risk of GERD with prolonged usage and damage to the skin. So these are all what? These are all risks associated with nasogastric tube. So immediately, now you see, 30 seconds you spent reading A, B, C, and D. And as soon as you read the first question, within 40 seconds or within 35 seconds, you already have the answer to the first question. So the answer is going to be text A. So you should be writing capital A over here. Right. Now let's come to text B. Second question over here. Okay, after text A. Now the second question over here is calculating the length of tube that will be required for an patient. Okay, so here what is the keyword over here? Calculating. Okay, so the medical staff must calculate, okay, how much centimeters or how much millimeters of length of tube will be required for a patient. So we have a pediatric patient. The pediatric patient needs to be given an NG tube. So for that, we need to, first of all, we need to calculate how much length of tube will be required. So where it is going to be, what is your intuition going to say? Yes, very good, right? So your intuition is going to say that it is going to be in text B. Because what is text B? Insertion. Okay, insertion over here, and here we have something related to wide bore, fine bore. Okay, so it is going. Is it going to be over here? Issues? No, issues are basically risks. So your intuition is telling no, it is not going to be there. Here it is what? A flow chart. So your intuition is telling no, it is not going to be here. And here it is administering fluids. That is, everything has been done. Okay, we have inserted the feeding tube. Now you're giving food to the patient. So it is going to be in text B because text B is about inserting. Okay, so when we're inserting, number one thing, the medical staff must calculate how much length is required. So immediately you will be coming to text B. Now, did you read text B? You did not read text B. You only read the headings, but your sixth sense is telling you come to text B. So you're trusting yourself coming over here, and then you are now trying to decide whether the answer is here or not. So let's read, it is mentioned. Let's see if it is mentioned. All tubes must be radio bake throughout their length. Okay, so here length is mentioned, but what is your duty? Calculating. Okay, the medical staff is supposed to calculate the length. Okay, so we need calculation. So we don't have anything related for that. For short-term use, ranges of size. Okay, now we are talking about different sizes over here. Long-term should be changed every month. In general, tube sizes. Now you see, calculating the length means sizes. Tube sizes of 6 FR are used for standard feeds, 7 to 10 for higher density, and tubes come in range of lengths, usually 55 centimeters, 75 centimeter, and 85 centimeters. So again, now let's see whether they have mentioned the calculation part. Find the most appropriate position for the child depending upon the age. Older children may be able to sit upright. Children, okay, so here I will tell you about the scanning and skimming method. Just give me a second. Now you see over here, measure from the tip of the nose to the bottom of the earlobe. Then from the earlobe to the xiphisternum. Now you see this particular sentence. This is where the calculation is, because what is the keyword over here? The keyword over here is how to calculate the length of the tube. Right. Now you see, this is where scanning and skimming comes in. Okay. Now you need to understand that the OET is giving you marks for finding answers to the question. The OET is not giving you marks for reading the paragraphs. So when you come to text B, inside your mind, calculating the length of tube, that must be in your mind over there. And with that in your mind, you should read the, you must go through the content over here. Okay, and this is where you should apply scanning method, because you're not exactly reading, you're scanning for the keywords that is in your mind, calculating the length. So here you see again, we have the length, but my brain is telling no, I want calculation. I want how the medical staff is supposed to calculate. So here they're talking about sizes, nothing about calculating is mentioned. Here also they're talking about hygiene over here, nothing about calculation. So see, I'm not basically reading, I'm just looking through it, I'm just scanning through it. Okay, because the keyword is there in my mind. Okay, and as soon as I come over here, okay, measurement basically means what? Calculation. So now my mind is telling, yes, this is what I was looking for. And here they have very clearly mentioned how are they supposed to calculate the length. Measure from the tip of the nose. Okay, so this is the tip of the nose, right? So from the tip of the nose to the bottom of the earlobe. So this is the earlobe. So from here to here, they need to measure. Then from the earlobe to the xiphisternum. So I don't know what the xiphisternum is. So basically from here to maybe here something, they need to calculate. So this is how the calculation for the length is done. And you have confirmed the answer. So the answer to the second question will be very easily B. That is, your intuition is already telling the answer is B, but you're just confirming whether the answer is there or not. So we have confirmed it by doing the scanning method. Okay, so scanning and skimming basically means not reading everything word by word, but having a memory of the keyword and reading to find the keywords. And as soon as you get a synonym, you should be very focused on that, and you should be able to confirm the correct answer. Now let's take a look into the third question over here. When alternative forms of feeding may be more appropriate for than nasogastric. So here, when alternative forms, okay, alternative basically means what? Substitutes. Okay, substitutes. Okay, so instead of this, use this. Okay, use this as an alternative. So alternative to petrol cars are diesel cars. Alternative to diesel cars are electric vehicles. Okay, alternative to that is public transport. That is substitute. Okay, so here the question is when. Okay, so when means what? And timeline. Okay, when alternative forms of feeding may be more appropriate than nasogastric. So when it comes to feeding pediatrics, there are different methods of feeding. Okay, one method is nasogastric feeding. There are several other methods as well. Method 1, method 2, method 3. And here the question is, which is more appropriate than nasogastric? Which is more better? Okay, so if nasogastric tube is not appropriate, okay, if NG tubes are not appropriate to the patient, which other forms of feeding can we use over here? Okay, so here, once again, let's trust our instincts over here. So it is not going to be in text D. Okay, so text D is about administering feeds and fluids. Okay, that is how fluids and thing are given to feeding tubes. So here they are talking about NG feeding tubes. And here it is about a flow chart. Not going to be here. And here is about inserting the nasogastric tube. But what did we read in text A? In text A, we read about issues. Issues means problems. Problems means inappropriateness. Okay, so NG tubes are not inappropriate. So my intuition is telling it could be in text A. Right, so text C, yeah, that is a good guess. Okay, no worries. Okay, no worries if your intuition went wrong. So text C is about a flow chart over here. That is step-by-step usage. That is step 1, step 2, step 3. And all these steps are related to NG tubes. Okay, so here the question is not asking about NG tubes. They're asking about feeding tubes that are substitutes, that are alternatives to NG tubes. Okay, so when will we think about an NG tube? So if petrol is very expensive, if petrol is a problem, then we'll think about electric vehicles, right? So when NG tube is a problem, only when NG tube is a problem, only we will think about an alternative. We'll think about a substitute. So in text A, we have already read there are certain problems associated with this. Okay, so let's see if there is some alternative is mentioned over here or not. Okay, now let's read over here. So, let's read the first sentence. Nasogastric is the most common route for enteral feeding. It's particularly useful in short term. Okay, so it is very, very useful in short term, and when it is necessary to avoid a surgical procedure to instruct a gastrostomy device. However, now see, however, in the long term, gastrostomy feeding may be more suitable. Now you see in the very first sentence itself, they have told you that NG tubes They are appropriate. They are appropriate if it is used in short term. That is for just 1 or 2 days we want to use. NG tube is important. And also when it is necessary to avoid a surgical procedure. So we want to avoid a surgical procedure. In those cases, we can prefer NG tubes. But what is the question asking you? What is more appropriate? Okay, a situation when NG feeding tubes are not appropriate. So here they're telling, however, in the long term, so if we want to feed the patient for 1 month, maybe 2 months, then something is more appropriate. What is that? Gastrostomy feeding, not NG tube feeding. Okay, so this is more suitable. And again, you have already read there are certain issues, right? So again, this is a tough question. Okay, I'm not going to deny that, but still you should be able to make the connection, right? And you should be able to write answer option A as the correct answer over here. Okay, so here also it is about eliminating. Okay, you have to eliminate. Okay, it is not going to be in text D. It is not going to be in text C. It is more likely to be in text A. And sometimes your intuition may go wrong, especially if it is a very tough question. Okay, so no problem. If it goes wrong, you just go to the next likely paragraph and see whether it is mentioned there or not. But you must never forget the question, right? When alternative forms. Now see, how about we do the sixth and seventh we will do. So let's read the sixth question over here. The sixth question is knowing when it is safe to go ahead with the use of a feeding tube for feeding. Now here they're asking you knowing when it is safe. Okay, so knowledge. Okay, so when do we get the knowledge that it is safe to go ahead with the use of a tube for feeding? Okay, so we have a patient over here and we want to know whether it is safe for the patient to be given the NG feeding tubes. So here we have a flow chart, right? So and see over here it is safe. Okay, so what are the keywords over here? The keywords is safe to go ahead with the use. Okay, so safe use of feeding tubes. So here my intuition is telling it is going to be in text C because step 1, step 2, step 3, step 4. Okay, so this is how certain steps are involved. Now you see over here now you see proceed to use. Okay, so see these. So we have already read these headings over there. So what's the heading over here? Proceed to feed or use tube. So this is when we know it is safe to use. Okay, and if it is not safe to use, this is the information is over here. Okay, so let's just understand this question over here. So first and foremost, we have to do something and we need to find if aspirate is obtained. So if aspirate is obtained, then we need to do this. If aspirate is not obtained, we need to do all these things. And then once again, we need to check if aspirate is obtained or not. So if aspirate is obtained, then they have to do this, something about pH, and then this is mentioned over here. Now see, if aspirate is not obtained, if then pH is between 1 and 5.5. Now see, this is when. Okay. Now, when is it safe to use? When is it safe to use an NG tube in a patient? If the pH is between 1 and 5.5. If the pH is between 1 and 5.5, now it is safe to proceed to use the feeding tube. Okay. So this is when we know that it is safe. Okay. Now here also, now you see this also. Competent clinician. Competent means a very skilled clinician. A very skilled clinician with evidence of training to document confirmation of nasogastric tube position in stomach. So if we have this situation over here, that is we have a very skilled clinician, okay, very skilled clinician in this particular situation, then it is safe because the clinician is very expert over here, is an expert. So it is safe. It is safe for us to proceed with the tube. So this is the situation. This is the situation where we can say that it is safe for the feeding tube to be used. So the answer to the sixth question is going to be answer option C. Right. So again, this is a tough question paper, but you have to train yourself, do all these things. Now let's take a look into the seventh question over here. So what's the seventh question? How regularly different kinds of tubes need replacing? Now you see over here, what are the keywords over here? How regularly, okay, that is how frequently different kinds of tubes need replacing. So different kinds of tubes. Where did we read different kinds of tubes? We read that in text B, right? See, we have two different types of tubes. We have wide bore tubes and we have fine bore tubes. So we can directly come to text B. Okay, now what is the question asking you? How frequently, that is how regularly should we change them? Now see, How often should we change whiteboard? Should be changed every 7 days. Every 7 days, we should change a whiteboard, and this every 30 days. So every 30 days, we need to change a fine board. Every 7 days, we need to change a whiteboard. Now see, that is the seventh question, right? So the seventh question is how regularly different kinds of tuples needs replacement. So that will be the answer. Okay, now you see, these are not specific questions. And some questions will be easy, some questions will not be very easy. Okay, and it will take some time. Slow and steady only you will be able to develop these skills. You should not expect everything to happen from day one itself. Now you see over here we have, how many questions did we do? We did 5 questions over here. Okay, now to do these 5 questions, we did some reading, right? So we read a little bit of text C. Okay, so we read a little bit of text C, we read a little bit of text B as well, and we read a little bit of text A. Now, how did we read text A, text B, text C, and text D? We read with a lot of effort, right? We had an aim in our mind. Okay, we had an objective. Okay, this is what I'm looking for. And with that objective, with that clarity, with that focus, we were reading. Right. So that is going to definitely help you out. On the other hand, if you're simply reading text A, B, C, and D, that much clarity, that much information will not get registered in your brain. Right. So this is why I told you by the time you finish the first 7 questions, and maybe the first 3 minutes itself, you'll be able to find all the answers to these questions. Right. And not only that, you will have established familiarity. Okay, you will become quite familiar with all these questions over here, right? And that familiarity will help you leaps and bounds when you're coming to the time consuming questions. So remember that short answer type questions and fill in the blank questions are extremely time consuming, right? And you need certain advantages. So advantage number one, you have 7 correct answers, or okay, let's imagine that from these 7, maybe the two, okay, so let's imagine that maybe the 4 and the 6, the 4 and 6 was a little bit tough questions. So you have temporarily, you have skipped it. Temporarily, you have skipped 4 and 6. And now you are in the, these questions over here, the eighth question. And here also you can expect very difficult questions. So difficult questions, you spend some time, your mind will tell you this is a dangerous question. Okay, don't unnecessarily waste this much time over here. You go to the next question. So if your mind is telling you that, then you temporarily skip it. Temporarily skip it and you go to the next question. Right. So by the time you reach the eighth question, advantage number one, you have majority of the answers correct over here. You're feeling very good about yourself. And what is the second advantage? You have familiarity. You have read text A, B, C, and D with a lot of effort, and that familiarity is really helping you out in the what do you call it? The time consuming 8, 9, and 10 questions. Okay, and these are a little bit time consuming questions because they are very specific, and you have to hunt, you have to locate where the answer is given. So let's take a look into the eighth question over here. So the eighth question is, what type of tube should you use for patients who need NG feeding for an extended period? Now see, what is the question asking you? What type of tube should you use? Okay, so we already know it is going to be in text B, because in text B, we have read about 2 types, right? Fine bore and wide bore. Now you see, how were you able to say the answer to this eighth question is in text B? Because you are familiar. You have established familiarity. Because of that, there is no need for you to hunt text A, text C, text D. Immediately you can go to text B. But you need to have more idea about the keywords. So let's see what the keywords are. So the question is asking you, what type of tube should you use for patients who need NG feeding for an extended period? So you're talking about long duration of time. So what tube should you use if you want to use it for a long period of time? Here it is fine bore, right? So see, fine bore 30 days. Now see, long-term use. Long-term use basically means extended period, right? So this is why synonym recognition is very important. Now see, here they have given long-term, here they have given extended period. Now see, completely different words, but same meaning. And this is why quality reading is important. So with a cool, calm, clear mind, you need to read the question, you need to understand, and then you need to trust your intuition with the familiarity. And see, without wasting much time, you can write the answer to the eighth question as fine bore, because fine bore are the tubes that you should use for patients who need the feeding for extended period. Right. Now let's come to the ninth question over here. So the ninth question is, what should you apply to a feeding tube to make it easier to insert? Okay, so here what product? So here also they're asking about a product. So what product? Okay, what should you apply? So application means what? It is external. Okay, so on the external surface of the feeding tube, what you apply? And what is the purpose of this application? To make it easier to insert, right? So what is your intuition telling you? Obviously, the word insert is there. So the word insert is there basically means you should be coming to text B first. Okay, so directly you're coming to text B, right? And now you need to find, okay, my duty is to find what product should be used for easy insertion. Now that should be in your mind. Okay, that keyword should be in your mind, and that in your keyword, that in your mind, what you need to do, you should scan. Okay, so don't read like this. All tubes must be radio opaque throughout their length and have externally visible markings, wide bore. This is not how you should read reading part A. You should scan. Okay, so here the question is asking you for easy insertion, what should be applied externally. Okay, so you must train yourself. Okay, so here you must go through all those measures. Okay, whiteboard for short term use. Okay, should be changed every 7 days. Ranges, no. Okay, so you should be able to, like, this is how you should scan. Okay, so that skill you need to develop. Fine board for long term use. Okay, so nothing related to application, external usage, no there. Tube size is 6 4 okay, 7 okay, we have tubes, okay, 55 centimeters. This is how you should go. This is what we call a scanning and skimming. Right. Okay. Wash and dry. Okay. Fine. Find the most appropriate position depending. Okay. Position. Okay. Find upright. Okay. Younger children. Okay. Like this. Infants may be wrapped in a sheet or blanket. Okay. Check the tube and then remove. Okay. Find the length of the tube. Okay. So all these things. Now you see. Okay. Now you see over here. Lubricate the end of the tube using a water-based lubricant. Okay. So what is the product over here? Yeah, very good, right? Water-based lubricant, because that is the product. Okay, that is the product we will use on the external surface of the tube. And why do we use it? So that it goes very easily into the patient's, GI tract. Okay, so the answer is going to be water-based lubricant. Now, don't write the full sentence. Some students, they write lubricate the end of the tube using a. There is no need. If you write the entire sentence over there, they will not give you any marks. Okay, because usually they give. Let me just take another question paper. Usually in reading part A, they do specifically mention. So if you go to the official sample materials of Cambridge materials, they have specifically mentioned that for short answer type questions, you should not write full sentences. So if you find the correct answer, but if you want to impress the evaluators by writing full sentences, they will reduce your scores. So do not write full sentences. Write one word or a short phrase only. Right. So that is how you need to write these type of questions. Right. So this is how it should be done. So scanning again. So you should be making mistakes, but you should be very honest with yourself. So if you struggle with synonym recognition, if you struggle with grasping the content, if you struggle with, scanning, if you struggle with skimming, then you should be very honest with yourself. Okay. These are the skills that I need a little bit more development in. Maybe my intuition. I need to trust my instincts a little bit more. Maybe my thought clarity. Maybe I get distracted very much easily. So if you identify, okay, these are my drawbacks, then you focus on it. It may take you 1 week, it may take you 2 weeks, but with more consistency, you will develop. So there is something called as the law of practice. Never ever forget this. There is something called as the law of practice. It is a law. Law means what? It will happen. The more you practice one thing, the better you good at it. You become good at it. Okay, so this is something that I read from a book. So, so nowadays, people say, I get distracted very easily. Okay, that is, Instagram and Facebook, like if I open it, I just keep scrolling mindlessly, and, I'm the thing. Okay, the reason why, okay, so I'm a little bit off topic. The reason why people are nowadays so easily distracted is because that is what they practice. They practice 5 hours every single day scrolling Instagram, scrolling Facebook, and Doing the more you practice something, the more the more better you become at it. So if you don't practice mindless scrolling, you will not become distracted. So don't blame, those kind of devices. Take responsibility and do it. So here also, there is a law of practice. If you want to improve on your intuition, if you want to improve on your synonym recognition, you just have to practice it, and eventually it will happen. There is no other way. That is why it is called as the law of practice, but it should be smart work. Okay, you should not work inefficiently. Okay, if you're working a lot of, if you're putting a lot of hard work, but if you're practicing with fake OET materials, okay, you're practicing with a lot of fake OET materials, you are, practicing with, without proper commitment, then that is what you will be improving. Okay, so anyway, let's come to the last two questions over here. All right. So what about the 14th question? Okay. So the 14th question is this one. What's the 14th question? The question is asking you, if aspirate exceeds pH 5.5, where should you take the patient to confirm the position of the tube? Right. So here, what's the question? What are the keywords over here? If aspirate exceeds pH 5.5. So did we read this? We have read this, right? Text C, right? So this is by establishing familiarity. Okay. For text one, the massive following questions, for one particular question, we had to go to text C. Okay. And we did go through. Okay. So now you're familiar, because that was not simple reading. You were not simply reading. You were reading with an intent. Okay. To find the correct answer. So, okay, the answer is going to be in text C. Now let's understand what the question is. If aspirate exceeds pH 5.5, exceeds means more than 5.5, where should you take? Where means what? A location. Okay. Where should you take the patient to confirm the position of the tube? Okay. So we want to find the position of the tube, and where should you take the patient if the pH's level is more than 5.5. So it obviously, it is going to be over here. Now see, if it is not between 5.5, now see here, if the pH, see again, this is a flow chart. Okay, flow chart. Again, you're all medical professionals. I should not have the need to explain what a flow chart is. You must be familiar by this all by now. So the pH, now see over here the pH is between 1 and 5.5, then it is safe. It is safe for us to use the feeding tube. But if the pH is not between 1 and 5.5, that is, it is less than 1 or it is more than 5.5. More than 5.5 means it is exceeding 5.5. So that is the question. If the pH is exceeding 5.5, then where should you take the patient? Now here they have written, proceed to X-ray. Okay, to the X-ray department, ensure reason for X-ray documented on request form. So where should you take the patient? You should take the patient to the X-ray department. Right. So that will be the correct answer. All right. So here, this is a slightly tricky question. Okay. What was the question? It was the 14th question, right? Okay. So let's just go to the answer key over here. All right. Now see over here, we can write all these words. Okay, so X-ray. Okay, so Dr. Ravi wrote X-ray. Very good. That is the correct answer. Or else, if you want, so X-ray is basically, a diagnostic test. The question is asking you, where should you take the patient, right? So if you write X-ray department, because we are talking about location, so this is optional. The department, if you're writing, is optional, or two. So the words you see in brackets over here, they're optional. If you want, you write. If you don't want, you don't write. Okay, but the most important word is X-ray. So X-ray you have to write, or if you want, you can write X-ray department, or you can write radiology. Okay, anyway, again, that is completely accepted. Okay, so like this, you see over here, the 15th answer is feeding pump. So is within brackets, which means is completely optional. If you want, you can write otherwise don't write, but this is compulsory. Feeding pump is compulsory. Right. So now let's come to the 15th question over here. And then we will go to the fill in the blank questions. So what's the 15th question? What device allows for delivery of feeds via a small bowel? Okay. So what was the 15th question that we read? The 15th question was a feeding pump. Okay. So here also they're asking what device. So here they're asking about one medical equipment, right? So what medical equipment allows for the delivery of feeds via the small bowel? Okay. So we have the small bowel of the patient, and which device allows delivery of feeds? Now, where is the answer going to be? It is going to be in text D, because see, delivery of feeds. Okay, feeds. Where did we read that? We read that in text D, right? administering feeds, fluid via a feeding tube. Right. So your intuition is telling, your sixth sense is telling it is going to be in text D. So you come to text D over here. Right. So now you see where it is mentioned. Now see the keyword is okay. See, this is what we call a scanning. So I did not read feeds are ordered through a referral to the dietitian when feeding directly. I did not read like that. I was having the keyword in my mind, small bowel. As soon as I saw the small bowel, I actually highlighted. So this is what we call as skimming. Okay, skimming basically means skipping through the information and coming directly to the keyword. Okay, so when feeding directly into the small bowl, feeds must be delivered continuously. Okay, delivered via using a feeding pump. So what device we should be used there? We should be using a feeding pump. So the answer to the 15th question will be feeding pump. Now you see, the reason why I was able to go to text D was because I was already familiar. I was already familiar with text A, B, C, and D, all right? Because I did the match the following questions first, and I did not read the entire content over there. I read only the headings. Again, those who have practiced OET multiple times and these strategies may be completely new to you, assure you it may be a little bit uncomfortable, but it definitely works, right? You have to be a strategist over here. Now let's come to the fill in the blank questions. Now fill in the blank questions are a little bit more complex. You know why? Because here you have to ensure that you are maintaining grammatical accuracy. That is, you have to give importance to the entire sentence structure over here. Right. Because see, here there is no need for you to be grammatically accurate. They're asking, okay, what device should we use? So you need to write the answer over here. But here, even though you're going to be writing the answer, you should write the answer such that when you read the entire sentence, it is going to form a meaningful sentence, a meaningful, grammatically accurate sentence. So just because you found the answer, don't immediately write it down. After you write it down, you check. You should check whether the entire sentence forms a grammatically accurate sentence. That is the plural tense, the singular tense, the past tense, the present tense. Okay, that small confirmation you must give over here. Let's read the 16th question. The 16th question is, if a feeding tube is not straight, when you unwrap it, you should dash it. Okay, and again, these are time consuming questions. So let's understand what is happening over here. We have a feeding tube. If the feeding tube is not straight, okay, so that is when we take it out of the packet, so the tube will be, in circles, right? It will be in circles. So it is not going to be straight. So if a feeding tube is not straight, okay, it is, coiled up when you unwrap it. Okay, so unwrapping means what? From the plastic cover. From the plastic cover, we are using a new feeding tube and it is not straight. Okay, what should you do it? So you should do something. You should. Should basically means what? Compulsorily. Okay, so if you find when you're unwrapping it, if it is not straight, what should you do with it? Now, what is your intuition telling you? Where is it going to be? It is going to be in text B, right? Inserting, because this is a new tube. We are taking it out of the plastic cover and we are going to insert it, right? So it is probably going to be in text B. Okay, that is what my intuition is telling. So let's see if the answer is in text B. Now, remember the keywords. What are the keywords? Unwrapping it. It is not straight. What we must do compulsorily if it is not straight. These things should be in your brain. Don't forget what you have understood. Okay, what you have read, what you have understood. Okay, so that is why these three steps are here also important. Step number 1, comprehension. Step number 2, retention. Step number 3, detection. Okay, so what is comprehension? Comprehension is understanding the question. Okay, and for understanding the question, you should do the keyword analysis, identify the keywords, underline the keywords, and so forth. Right, and then you have to register everything to your memory. You must not forget what you understood. Okay, so if it is not straight, unwrapping it, if it is not straight, what must the medical staff do? That you must register into your memory. That is what we call as a retention. And this in your memory, you should come and you should detect for the answer. Comprehension, retention, detection. So don't forget the answer. Don't forget the question. Okay, so now let's see. Let's see whether it is going to be here or not. Okay, so here Find the most appropriate position. Okay, depending. Sit right. Okay, younger children. Okay, infants may be. Okay, now you see over here wrap. Okay, the first keyword is coming. So, but here they're telling infants may be wrapped in a sheet or blanket. That is here. Infants are wrapped. Okay, so that is the first thing. Now, the second step over here is check the tube is intact, then stretch it to remove any shape retained from being packaged. Now, see how clever the OET people are. Now, here, what are they telling? Okay, check. Okay, you must check whether the tube is intact. Intact basically means there is no damage. Okay, that there is no damage. And once you have taken it from the package. Okay, so see, you have taken it out of the package. But if you're taking it out of the package, if the tube is coiled up, if the tube is coiled up, it will have that circle shape with them, right? So that is what it's like. So if it is, if it is having the shape over there, and if it is not straight, okay, it is not going to be straight. If you want to remove the shape from being packaged, what should the medical staff do? They should stretch it. Okay, so they should stretch the tube so that it is straight, so that they are able to remove the shape over here. So now this is what they have to do. So what should you write over here? So here you should write, if a feeding tube is not straight, when you unwrap it, you should, what's the answer going to be? Yeah, so Dr. Ravi has said stretch it. Now you see over here, that was a very good attempt. You see, stretch. But here already the word it is mentioned. Okay, already the word it is mentioned over here. So therefore, there is no need for us to write stretch it. Because if you write stretch it over here, now you read the sentence, if a feeding tube is not straight, when you unwrap it, you should stretch it. Now see, two its are coming. So that is not a grammatically accurate sentence. That is why you have to give, oh my God, 1 second. So that is why, that is why when you are writing, you should make sure that you are ensuring that after you write the sentence, it forms a meaningfully grammatically accurate sentence. Now, if you write stretch it, now see that one extra small tiny word you're writing, IT, they will reduce some marks. Okay, they will not be giving you full marks over there. Now, let's take a look into the 17th question. Patients are more likely to experience dash if they need long-term feeding via the tube. So here, patients are more likely to experience something. Okay, more likely means they have a more chance. Okay, they more chance of experiencing. So this is something that they can experience in their body. Okay, experience something if they need long-term feeding via tube. So what are the keywords over here? Long-term and something they will experience. Now, where did we read long-term? I think we read it in text A also we have read long-term. Text B also we have read long-term, right? Now see over here, long-term over here. Okay, long term over here also, and here also we have read about long term. Okay, so but here what's the question? What do you get understand from the question? The question is patients are more likely to experience something if they need long term feeding via tube. So again, they are talking about a problem. Okay, they're talking about a problem, that is if you use it for a long time, they are going to be no, yeah, okay, a fine bore is also associated with the word long term over here. But again, remember the question. The question asking you, what are the patients going to experience? What are the patients going to experience if they need long-term feeding via tube? So in text A also we have read long-term, right? So right here. Right, now see over here. Now see, come to the issues over here, come to this one. Increased use of gastroesophageal reflux with prolonged use. Okay, now see how did we come this? Because over here we have the word long term over here. Okay, and the word issues. Okay, so again, issues basic. Again, we have a small memory of what we have read. Okay, so if what are patients going to experience if they require long-term usage? So these are all problems over here, right? Now see prolonged use. So prolonged use basically means what? Long-term. Okay, long-term use. And what are the patients going to experience? The patients are going to experience gastroesophageal reflux, right? So what will be the answer over here? Gastroesophageal reflux. This is the answer. This is what they will experience if they require prolonged usage. Right. Again, not a very easy question, slightly tough question. Here also we have long term. Okay. Again, we have long term, but over here, nothing about what patients will experience. Patients, what they like this, here they have mentioned the type of thing over here, and they have mentioned how to insert the tube hygienically. Okay, so here this is the more appropriate answer. So you will be writing the and 17th answer as patients are more likely to experience gastroesophageal reflux. Now let's do the 20th question over here. Now the 20th question, if a child is receiving dash via a feeding tube, you should replace the feed bottle after 4 hours. So here we have the first keyword, child. And what is the linking word? Linking word basically means what? Linking words are the words that are closest to the missing information. So we have the linking word is a child is receiving something. Okay, a child is receiving something via a feeding tube. Okay, you should, so if a child is receiving something, so something is being received by the feeding tube, you should replace the feed bottle after 4 hours. So if a child is receiving something, then we should replace the feed bottle after 4 hours. So what are the key words over here? The key words over here are 4 hours. Okay, 4 hours, feeding tube, and receiving something. Okay, and replacement. Okay, something needs to be replaced after 4 hours if a child is receiving something from the feeding tube. So all these things should be in your mind. Now, what is your intuition telling? Feed, right? So it is feed over here. So it is maybe going to be in text D. Okay, the feed over here, because text D is about feeds over here, right? So let's see whether it is mentioned here or not. So here, let's see whether it is mentioned. Now, see, feeds are ordered through a referral to the dietitian. When feeding tubes, now see over. Oh, no, you see 4 hours. So see, this is what I was waiting. Okay, 4 hours, because in the question they have mentioned specifically 4 hours. Now see, the second keyword is there. Feed bottles. Now see, replaced. Replace means change. Feed bottles must be changed every 6 hours or every 4 hours for expressed breast milk. Okay, so what is the patient receiving over here? The pediatric patient or the child? If the patient is receiving, breast milk through the feeding tube, then the feed bottles must be replaced every 4 hours, right? So what's the answer to going to be the 20th question? The child is receiving, either you can write express breast milk or you can write breast milk via feeding tube. You should replace. So the answer to that is that one, breast milk. That is the 20th question. Right. So this is what we discussed. Now I had actually, so if you just give me like 5 minutes time, I have a small intuition practice. That is, I have basically made a small document over here. And there are like 10 questions. So we don't have that much time to discuss the 10 questions. However, let's just do at least, 3 or 4. Right. So just give me a second. Yeah. Okay, so here I'll just try. Okay, so this is what you call as risk improving your intuition. Okay, because that sixth sense you should develop in, especially in reading part A. So maybe the first 3 questions. The first 3 questions we will do. Now the first question over here is risks and complications. Risks and complications. So what do you think the answer is going to be? Risks. So if the question is asking you about risk and complications, is it going to be in, type the answer in the chat box? Is it going to be is the answer going to be in text A, or is it going to be in text B, or it's going to be in text C, or is it going to be in text D? What is the intuition telling? The question is about risks and complications. Yeah, very good. Okay, so answer option A, right? So answer option A is where the answer is going to be. So risk and complication, tube use, okay, pros and cons, because over there we had something. Now see over here, the second word, this thing is tube measurement technique. Okay, so what technique should we use to measure it? So what is your intuition telling you? Yeah, very good, right? It is going to be in text B, because there we talked about wide bore, fine bore, and also the measurement, right? From earlobe to the nose, and that is the calculation method. All right. So now how about we do the maybe the 10th question, short term versus long term tube types. What is the answer going to be the 10th question? Very good, right? That's see how your wonderfully your intuition is working. The answer is going to be text B. Okay, so now maybe we'll do the how about we do the Which question shall we take over here? One more question. Okay, how about the seventh question? Referral for feed planning. What is your intuition telling you? Is it going to be in A, B, C, or D? Referral for feed planning. Feed. Okay, so here it is about feed. Okay, so see what is the keyword in referral for feed planning? So it is going to be referral. Okay, so it is going text D. So feeds over here, and see referral to a dietitian. Okay, that's just going to be okay. So this is how that intuition. So I'll send this document to you through WhatsApp after the session is done. So just see. Okay, just see if the intuition is working. Right. So this is how you should do reading part A. Okay. So again, you have to be a strategist over here and you should bring in all these things. And again, remember the law of practice that I have discussed. All right. So let's have a small recap of the session. So let's see what and all we discussed today. So in today's session, we talked about the importance of time management. So here, everything is related to speed, strategy, and clarity under pressure. Nothing is related to your language proficiency, right? So these are the skills you need over here. Okay, so about time management, we talked about prioritizing the questions. Okay, don't read A, B, C, and D and waste a lot of time, energy. Prioritize the questions and just read the headings. Okay, just read the main headings and topics there, and then come directly to the questions. And then we talked about why doing the match the following questions are first, because it helps build your momentum. Okay, it is going to make you feel good about yourself, going to boost your confidence levels, and it will establish familiarity. Then it is all about sensing where the answer lies. That is, you have to trust yourself, trust your instincts, and then believe your intuition and go there and try to see whether the answer is mentioned there or not. Okay. And then when it comes to fill in the blank questions, even though you have found the answer, you have to ensure that you have grammatical accuracy there. So tenses, past tense, present tense, singular tense, future tense, and all that, plural, singular, and all, you have to make sure that when you're writing the correct answer there, it forms a meaningful sentence. There should be thought clarity and sentence structures. And when it comes to short answer type questions, precision phrasing. So do not overthink and don't, write very long sentences, write very short sentences there. Yes, Lakshmi, you can leave. Right. Thank you. And then synonym recognition. Okay. Then we talked about the importance of synonym recognition and trusting your instincts. Okay. So this is what we discussed today. Right. So that is the end of today's session.